Good afternoon. I'm joined by the woman to my right, the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. To her right, the Department of Health's Communicable Disease Service Director, Dr. Ed Lifshitz. Great to have you both, as always. To my far left, another guy who needs no introduction, the Superintendent of the State Police, Colonel Pat Callahan. Pat, thank you. And to my immediate left, he's back. It's a Thursday to get an update on where things stand on the unemployment front. Labor and Workforce Development Commissioner Rob Acero-Angelo. Rob, great to have you back. Today marks 100 days, hard to believe, since the first case of COVID-19 in New Jersey was confirmed. And in some ways, it's hard to believe that it's been 100 days, and in other ways, it's hard to believe it's only been 100 days. And it's equally hard to fathom the impact this virus has had on our state, our communities, our economy, and frankly on our nation and on the world. But just as we remain committed to continuing our fight to save lives, we are committed to putting our state on the road back. We are committed to our restart and recovery. We are committed to getting to the new normal that we know awaits us somewhere down that road. For 100 days, we have asked you to take extraordinary steps. We have asked you to take to heart the need for social distancing. We've asked you to forego so many of the little things that we once could simply take for granted. We've asked you to wear face coverings when you're out in public. We've asked you for your patience as an unprecedented pandemic engulfed our state. I run through some of these charts every day, but I think today at our 100-day mark, they deserve another look. 2 months ago, we were reeling. That was plus or minus the peak. COVID-19, as I say, was at its peak in New Jersey. Our healthcare system was nearing full capacity, and some hospitals were already there. We had fears of running out of beds, ventilators, personal protective equipment, and we were running full-scale efforts to ensure that we did not. Now look at where we are today as compared to then. New hospitalizations are down more than 90%. And total hospitalizations are down 80%. Ventilator use has dropped nearly 80%, and the number of patients in our intensive care units is down by just over 3/4. Over the past 2 weeks alone, we have continued this progress, and just as importantly, we have done it as one New Jersey in every region, every part of our state, all of us together. We have slowed the rate of transmission to one of the lowest in the entire country. That's 0.62. When at our peak, so our peak was just 2 months ago, each newly confirmed case was spawning at least one other new case. If you go back just a scant 3+ weeks before that, it was every person infecting over 5 other people at that peak. Now we know we are not done. I wish we were. We still have some numbers we need to keep driving down, as you can see here. But I am confident that our odds, this is New Jersey after all, we've always beaten the odds. The news reports today are noting that some states which did not take the threat of COVID-19 as seriously as we did and which rushed to reopen are now seeing some of their biggest spikes in the very same metrics that we see falling across our state. As I've said before, we have worked as quickly as we can, but as safely as we must. It's been common sense for the common good, and we're seeing the results today. So at 100 days, I simply, and I know the team here, and particularly Judy and Pat, who join me every single day, join me in saying simply thank you to the millions of New Jerseyans who understood why we took the actions we did and why we made the requests of you that we have, and who remain understanding of the need for us to remain vigilant. It is because of you that we can look to Monday when we will enter stage 2 of our restart and recovery. You all did this. You are the ones making this happen. Now on to some business of the day. Commissioner Acero-Angelo is back with us to give us the latest update on the Department of Labor's continuing hard work to ensure that every New Jerseyan whose job has been impacted by this unprecedented pandemic receives the unemployment benefits they deserve and to which they have paid into. As Rob will point out in a few moments, the number of new claims has dropped again, thank God, giving the department staff the opportunity to continue chiseling away at the claims that still need to be resolved. The number of New Jerseyans who have claimed weekly benefits since COVID-19 sidelined so many of our businesses is by far the largest volume the state labor department has ever served in such a short period of time. Of those, the overwhelming majority, 94%, have received payment. Bless you. We can also report today that every single one of the 70,000 residents who had exhausted their previous eligibility and are eligible for expanded federal benefits have been cleared to receive that assistance. All in all, more than $6 billion has flowed into New Jersey's households, and the department will not rest until every claim is settled and every penny is properly distributed. So to you, Rob, and your tremendous team, I thank you for all you have done. This task has been nothing less than enormous, and I know at times it seemed that just that when you thought you had carried the rock up the hill, it rolled back down again. That's the impact that COVID-19 has had, and the department has responded against the odds and the strong headwinds blowing against you. So hats off to you. Now next, as I mentioned, on Monday we will enter stage 2 of our road back when our restart and recovery kicks into the next gear. And as we have prepared to enter this stage, we have worked hard through both our Restart and Recovery Commission and advisory councils to make this effort a partnership with our business owners and leaders. Several weeks ago, we put out a statewide business survey of New Jersey business and nonprofit leaders. We wanted to know what the main challenges and concerns facing our business community were and how we could confront and overcome them together. More than 4,000 folks in businesses, entities responded. More than half of them, and this is worth looking at for a minute, more than half of them, and this is on the left, said their number one concern was consumer confidence. They understand, as we do, that residents aren't going to go back out again and that workers aren't going to want to return to their jobs without the confidence that their health and safety and that of their community is the top priority. And more than half also said, and this is the right bar, that they're looking to us for the guidance they will need to help restore this confidence and reopen. So stay with us, Dan, for a second. So you'll see on the left, again, what is your biggest concern in reopening? Customer confidence, 51%. The next level down, and there were other good choices, 14%. And on the right, who are you taking your guidance from? Folks want to hear from the people they know and trust in the state, at the state level, perhaps at the local level. Department of Health certainly leading that, Judy. And again, with some other good choices, overwhelmingly 54% said that, and the next highest bidder there was in the 20s. So you get some sense of not only what the biggest issue is, and that's our job to deliver that confidence together. That's to reopen properly. That's to have testing at scale, as we discussed yesterday, contact tracing at scale, isolation plans. It's not a question of will this virus pop up again. It will. The question is, what are we going to do about it? Do we have the plan in place to surround it and drive it back to the ground? That's what you all need to have the confidence to bring your family back out and re-participate and partake in our economy, and we will deliver that, I promise you. So these results led us to create something we're calling the One Jersey Pledge, a pact between businesses and consumers on the one hand, and employers and their employees on the other. And by the way, vice versa. It lays out clearly that we all share a responsibility to see our restart and recovery through. The One Jersey Pledge is the glue that will ensure the guidance that Judy and her team release across industries actually sticks. These signs you see will be placed in stores and work sites across our state. It's the sign that says that we're all in this together. It's the sign that says getting past COVID-19 is our top priority. It's the way we know we can build the confidence we need to get our economy back to being where we know it can be, strong and fair for every community and for every family. Again, I thank the more than 4,000 businesses and nonprofits who answered our call, and to the hundreds who are playing a direct role as members of our Restart and Recovery Advisory Councils. New Jersey is a small business state, and getting our main streets and downtowns working again is proof that public health indeed creates economic health. And with that, let's take a measure of the public health by reporting the overnight numbers. Yesterday, we received an additional 539 positive test results, and the statewide total is now cumulative 165,816. Here are the new cases graphed in relation to the past several weeks. That's a graph trending in the right direction. The daily positivity or spot positivity for test samples from June 7, which was Sunday, was 3.8%, again in the right direction. Moving to our long-term care facilities, we continue to work hard to push down the curve in terms of newly identified cases of COVID-19. As you can see, there's a total of 34,866, and to stem the loss of residents, the blessed souls, to COVID-19 related causes, 5,734 lost lives in our long-term care facilities. In our hospitals, as of last night, there were 1,512 patients being treated for COVID-19. That's, by the way, our sixth straight day, Judy, being below 2,000 statewide. And the number of residents at our field medical stations is now in the single digits at 9. This is the total of the breakdown of hospitalizations across regions. The number of patients reported in either critical or intensive care dropped again yesterday to 445. The number of ventilators in use also dropped to 319. Yesterday, I almost hesitate to report this because neither Judy and I believe this number. I wish it were true. 27 new patients were reported as entering our hospitals, but we know there's an issue with the data. We'll get that back to you as soon as we're comfortable with it. However, we can say with great confidence that 169 live residents left our hospitals. Here are yesterday's hospital admittances and discharge numbers charted across regions, and we know that on the admittance side, in the north and central region, we had a data hiccup. However, with that being said, this is not a data hiccup. We must report with the heaviest of hearts the loss of another 70 New Jerseyans to COVID-19 related complications. Blessed souls, each of them. We've now lost a total of 12,443 brothers and sisters from our New Jersey family in the 100 days since our first positive test result. Think about that for a moment. Now let us recall a few more of these precious lives lost. We begin today in Edison, the longtime home of Dolores Simon. There's Dolores. She was 71 years old and known to many as Lois. Born in South Carolina, Lois moved to Newark after she graduated high school. That move led her first and foremost to meet her life partner of 44 years, Giobe Skeet Thagard. But she also found her calling, spending the quarter century working as a transport customer services technician at University Hospital in Newark. She was a proud and giving woman, a woman of faith and compassion, and had a knack for making sure everyone around her was okay, traits that made her a treasured part of University's hospital's family, and boy, have I heard from them about Lois. But she took special delight in her own family. They were her greatest pride and joy. Lois leaves behind her two daughters, Marquetta and Sharita, who goes by Rita, and I had the great honor of speaking with Rita yesterday, and Rita's husband, Harold, along with 7 grandchildren, 5 great-grandchildren, and 4 sisters. And let's not forget the University Hospital family she leaves behind as well. I know she will be missed by all who had the good grace of crossing paths with her. May God bless you, Lois, and your family you leave behind. Next, we remember the Reverend Clarence Sickles of Hackettstown. Clarence was 99 years old, and here he is pictured with his beloved Jean. He got his undergraduate degree at Rutgers University in 1944, but his childhood dream was to become a priest, and he achieved that goal in 1948, following his education at both Columbia University and the General Theological Seminary in New York. 2 years later, he would achieve another goal, marrying the love of his life, his wife Jean. He served as chaplain in Sparta, Fairlawn, and at Rutgers University, and assumed the role of rector at St. James Episcopal Church of Hackettstown in 1953. That was his last stop. Through his work at St. James, he helped create a nonprofit corporation and build a retirement community to ensure that area's seniors could live their final years in dignity, and that included ultimately him. His work on behalf of older New Jerseyans was recognized in 1978 when the General Theological Seminary awarded him an honorary doctorate in divinity for his work with the elderly. Clarence also stayed engaged in creative and academic pursuits, all to forward another life goal, to make the world a more harmonious place. He was an author of religious history and even wrote 3 children's books, each an extension of his values. He leaves behind his beloved wife, Jean, of Washington Township. They celebrated, by the way, their 70th anniversary just 4 months ago. He also leaves behind his 4 daughters, Mary, Martha, Monica, and Margaret, with whom I had the great honor of speaking yesterday, and 4 sons, Mark, Michael, Martin, and Matthew. You might notice some commonality among the 8 children, and their families, which graced him and Jean with 13 grandchildren and 7 great-grandchildren, and he leaves behind a grateful Hackettstown. May God bless Reverend Sickles, and I want to thank my friend John DeMeo, who raised the passing of Reverend Sickles with me. So John, if you're watching, thank you. And I heard a story that really overwhelmed me from Margaret, his daughter, and I want to focus on this for a few seconds because it speaks not just to him and his humanity and the respect he engendered, but it speaks to our heroic healthcare workers who are working across the various needs of our sick and infirmed in our state, but especially going in and out of long-term care facilities. And the story I heard, Judy, and you as a former nurse will appreciate, I guess once a nurse, always a nurse, I shouldn't say former. His family could not see him in his last days. That's common to so many of the families that we speak to. Clearly, the restriction of folks going in and out of these facilities, including segregating patients and staff by their status, whether it's on a floor or a wing or even a different building. We have no choice. But the aid team that worked with Reverend Sickles was so moved by him and his leadership that in his final day, they all clocked out and sat around him as he passed because his family couldn't be there. Unbelievable. What heroism. And finally, today we remember Ruthie Saab, and the guy to my left knows Ruthie well, of Willingboro, who spent much of the past 3 decades as a dedicated and recognized employee of the New Jersey Department of Labor and Workforce Development. And Rob, I know this one hits home to you and Team Labor. Ruthie began her career with the department back in 1992, following her graduation from Texas Southern University. Ruthie rose through the ranks at the department, and her knowledge and expertise were highly valued. Ruthie grew up in Liberia and was a proud member of the Liberian community, and she was selfless as well as a regular volunteer with the Trenton area soup kitchen, making sure that others were fed. A woman of faith, Ruthie was executive coordinator and administrator of the Bethel World Outreach Ministries International Dominion Center in Trenton, and a founding member and president of the Sisters Club, also in Trenton. Ruthie is survived by her daughter, Ashley, with whom I had the great honor of speaking yesterday, and grandson, Malaki, as well as her stepmother, Nahida, and 8 brothers and sisters, along with countless relatives and friends from her church, her sisterhood, and of course, her Department of Labor family. She was only 59 years old. Ruthie, bless you and thank you for your years of service to the people of New Jersey. You will be missed by many, and may your memory bring a smile to their faces and peace to their hearts. For them and for everyone we have lost, our flags remain at half-staff. Now, before I close and hand things over first to Rob, then Judy and Pat, I want to give our weekly update on something that, while it may not be directly related to COVID-19, has a tremendous impact on our recovery, and that is the 2020 census. For the past several weeks, I've been urging you to take a few minutes and go to 2020census.gov to make sure you and your family are counted. And many of you have, and I thank you. Our overall response rate continues to climb. Today, it stands at 63%, more than 2 points above the national average, and I'm proud to report that this past week we climbed another space in the rankings among our peer states. Our next goal is to overtake Colorado and climb higher. Here are the response rates across our state. First, a quick note about this map, and especially Cape May County. We know your response rate is being skewed because a lot of the homes which haven't yet responded aren't your year-round homes, and these property owners have likely already responded from their primary homes. So if you own a second home in Cape May County, we ask you to go to 2020census.gov and register that home as a seasonal home. Then we'll have a better idea of how many Cape May residents have responded to the census. And we look forward to continuing our partnership for a complete count everywhere, and in this case, especially in Cape May. Beyond that, across the entire Northeast region, not just New Jersey now has 6 of the top 12 reporting counties, and that's great. Hunterdon, Morris, Burlington, Somerset, Bergen, and Gloucester. Now we still have areas where we know we're being undercounted, and the Department of State, in coordination with our local partners, is going to soon be taking to the streets to urge more residents to fill out the census. And there will be a special focus for the counties and communities where we need to see more responses. To be clear, the census is secure, it is easy, and it's really important. Your information is protected by federal law from ever being used against you, and we've got your back. But this information is vital in determining how much money we get back from Washington, for family nutrition programs to our public schools, from Social Security to unemployment insurance compensation, and from transportation to COVID-19 relief and everything else in between. So take a moment and go to 2020census.gov and be counted. It's quick, it's our civic duty, and it's for everyone. An accurate count can mean literally billions more federal dollars coming to New Jersey. It's our money, let's get it back. We undercounted this state tragically in 2010. We cannot do this again in 2020. The census is in many ways, frankly, like our entire effort through these past several months. One New Jersey pulling together to create a better and stronger and fairer future. So let's keep at it on all fronts. Let's keep practicing our social distancing, and when our economy takes its next step in our restart recovery on Monday, let's remember the One Jersey pledge, and let's keep moving forward together. And on that, I want to briefly address the action taken by Asbury Park's governing body regarding indoor dining. All of our efforts to date have been centered around the very basic principles of protecting health and protecting people. We have relied on science and data, period. That's why we've been clear about 2 things. Public health creates economic health, and data determines dates. We have come too far together, folks, to see all the good 9 million New Jerseyans have done undone in haste. One step forward today cannot, must not, will not lead to 2 steps back tomorrow. I fully understand and appreciate the economic pressures, believe me, especially our small businesses, including the folks in the hospitality industry. You've been crushed. We get it. We understand it. And they're felt not just in New Jersey, but they're felt in places like Massachusetts and New York City and Philadelphia, which all have suffered from this virus in a way similar to us, none of which, by the way, are reopening indoor dining. None of them. With all due respect, we cannot have communities mirroring the cavalier actions taken in other states which have not put a premium on making the health of their residents priority number 1. I noted at the opening of my remarks how those states are faring. And in many cases, sadly, we don't wish this, believe me, it's not good. This is, by the way, how our RT rate compares among our peer states and region. And if there ever was an eye chart, trust me, this is it. Take a good look, if you can, at the states above us, specifically Texas, Georgia, and Florida, states which rushed to reopen. These are the states the news is full of today. States which are now seeing increases in hospitalizations, in ICU counts, and in more residents going on ventilators. Arizona, I don't know where it is on this chart, but they're another state you can add to that list. We have lived this already, folks. We don't want to go living it again. We've gone through hell. Please, let's not go back through it. And my job, frankly, is not to worry about the next headline or, frankly, the next election. It's about keeping that rate of transmission down. It's about saving every single life that we can save together. So the actions of the Asbury Park governing body, a great community in the state, bless their hearts, their actions are inconsistent with my executive order. We cannot have one set of rules for one town and another for another town. We move as one state, guided by science and data, period. And with that, I will now turn things over to a guy who's been, to say the least, busy as heck over the past number of months, an outstanding leader, the Commissioner of the Department of Labor and Workforce Development, Rob Acero-Angelo.
Thank you, Governor, and thank you, seriously, for taking a moment to honor Ruthie. On behalf of her coworkers, I know her presence is going to be missed around our office. And I want to extend my sincerest condolences to Ruthie's family. I spoke to Ashley as well last week. Since I last joined you, the number of new weekly applications for unemployment declined to 23,166. I'd like to note this is the lowest weekly total since the COVID-19 pandemic walloped our workforce in mid-March. Since then, more than 1.2 million workers who lost jobs or had hours reduced have applied for unemployment benefits in New Jersey. Industries with the most claims are casinos, retailers, food service contractors, restaurants, and airlines, with 1 of every 4 claims from food service occupations. Another 70,000 or so people, as the governor mentioned, who are unemployed or exhausted their benefits before COVID, have now been deemed eligible for 13 weeks of additional benefits known as Pandemic Emergency Unemployment Compensation. All of these claimants have now been notified they are eligible to certify for benefits. Every week, as more people exhaust their benefits, we'll be adding to the roles of those collecting PEUC assistance. Last week, New Jersey passed the 1 million mark in the number of people who have claimed benefits during the pandemic. I'd like to take a moment to put that number into context and to correct some recent erroneous reporting. The U.S. Department of Labor has strict rules and timelines around what data we report and when, which is why I'm always here on a Thursday. The metric we are required to use, the number of individuals who claimed benefits between March 15th and June 6th, was 1,021,339, by far the largest volume of claimants the State Labor Department has ever served in a year, let alone in 12 weeks. Of those, 94% have received payment. During the same period, $6.25 billion has gone out the door and into the pockets of our New Jersey workers. That's an average of more than $1,000 per worker each week, and most have received more than $6,000 to help their families stave off the financial hardships of COVID-19. We know in many cases this may not be enough, and there are still folks who need to hear from us. Not an hour goes by that we don't think about New Jersey workers who, for the first time, are struggling with putting food on the table or paying bills. We absolutely hear the pain in their voices, their emails, and their calls, and we want to make this process easier for them at every turn. Governor, we know that not every New Jersey worker is getting the help they need yet, but we are working on it, and as you know, we haven't stopped. We expect our new contracted call center to be online early next week, and this will have a significant impact on being able to have more claimants talk to somebody. And this is in addition to the hundreds more of our own employees and staff lent to us from other state agencies who are continually being enlisted to help us. This is incredibly important because it'll help free up our most experienced agents to focus on the more complex claims in which there is a sticking point. Either the employer contests the separation, or there are insufficient wages reported, or income information must be obtained from another state, or there could be a question about the employee's social security number, work status, or employment history. We know how tough it has been for these claimants to try to stretch their last paycheck, go to a food pantry, or delay paying their rent. The knowledgeable, dedicated staff at the Department of Labor are used to dealing with customers during stressful times, and each and every one of us is working day and night trying to resolve their claim issues and pay all eligible claims quickly. Statistically speaking, though, roughly 240,000 or so New Jersey workers who applied for benefits will not qualify for state unemployment. But we won't rest until every eligible worker gets the help they need. I truly feel for each and every person who has had trouble reaching our department when family-sustaining income is at stake. We understand the main frustration of our customers has been the inability to get someone on the phone. We are making headway, and we will be in a better position with our new call center by increasing the supply of agents on the phone. We've also been doing all we can to reduce the demand by eliminating the need for a claimant to speak to an agent in the first place. In the past 2 months, through our constantly updating of automation processes, we have eliminated the need for an additional 500,000 plus contacts between claimants and our call centers. Also, thanks to recent upgrades in our payment systems, we are now able to expand the certification window. That is, the days and times allotted for customers to certify for their benefits based on their Social Security number. This request initially came in for religious accommodation. However, this will benefit all claimants, with 2 full makeup days on Friday and Saturday to certify for weekly benefits. The unemployment process is cumbersome, with confusing rules and federal guidance that have delayed the process for many, and left some waiting for weeks, if not months, to become eligible. As recently as June 5th, last week, the Trump administration gave us explicit instructions on the steps we must take to verify specific claim information. We could have 1 million call center staff, but even that wouldn't necessarily lessen the burden for too many folks tied up in these federal requirements. I look forward to working with our congressional delegation and my counterparts in other states to bring about the big changes everyone experiencing the current flaws in our UI system knows we desperately need. Obviously, no one would wish for this pandemic, but I hope it serves as a long overdue wake-up call to strengthen the federal partnership and funding needed to fix this national system. We remain steadfast in our mission to get everyone their benefits, but we also must protect workers and employers as our economy opens back up. Our unemployment system was created for, quote, the common good as well as in the interest of the unemployed individuals against the distress of involuntary unemployment, unquote. The legislature and Governor Murphy's predecessor, Harold Hoffman, were protective of workers facing economic insecurity, but at the same time recognized the UI Trust Fund should be preserved against claims by those not intended to share in the benefits. The UI system places a great emphasis on working and attempting to find work. Nevertheless, our laws make clear where a worker raises substantial health and safety concerns and the employer fails to remedy such concerns, that worker may lawfully refuse to return to work and continue collecting UI benefits. This determination is highly fact-specific and it is not easily met. Today, our department is releasing guidance for employees and employers alike, illustrating these principles, so workers can be fully aware of their options if they have significant concern about returning to an unsafe workplace, and businesses know their rights when someone refuses to return to work. No one should be forced to choose between their livelihood and the threat of contracting COVID-19. So no, a worker cannot just choose to stay on unemployment, but if an employer, for example, is violating an executive order based on public health and safety and opening too early, that action in itself is putting its employees at risk, and they can certainly exert their right to refuse to return to work and continue to collect unemployment. The guidance also answers questions we have received concerning high-risk individuals with serious underlying health conditions, as well as those who cannot return to work because their child's school or daycare facility is still closed because of COVID-19, and how they may be eligible for pandemic unemployment assistance benefits. This guidance and more can be found on our homepage at NJ.gov/labor. I'm also proud to announce that NJDOL has been chosen to receive $8.5 million through the COVID-19 Disaster Recovery National Dislocated Worker Grant from the U.S. Department of Labor. These grants are made available by the federal government to fund temporary positions related to the recovery efforts of a disaster that leads to unexpected job loss. We will use the funding to partner with our county workforce development boards on job development, short-term skills training, and on-the-job training. As some jobs wane because of the pandemic and new opportunities are created in its wake, we want to make sure we are doing all we can to prepare New Jerseyans for the future of work in this great, resilient state. Thank you for your time today. Governor?
Rob, thank you, and thank you for everything you and your team have done, and God bless Ruthie. I've said this on a number of occasions when you've not been here, but I've been struck, and this isn't in every case, but I can't remember a case in the past 6 to 8 weeks that was not the challenge that was not very particular to the individual.
Yes.
And that doesn't include, obviously, the new filings, which obviously folks are going through for the first time. And thank you for your leadership, and I want to thank everyone out there for your patience, because it's been a frustrating period for everybody, and overwhelmingly folks have really done the right thing and understood that this is complicated. A lot of it because of the feds and the federal reality. But folks have been extremely, overwhelmingly patient, even in really tough, challenging times. So, and thank you to you and your team, Rob. With that, the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli.
Thank you, Governor, and good afternoon. Well, yesterday, on the 99th day since our first case, New Jersey passed the 1 million mark in diagnostic tests performed in our state. We need to continue this trend. Despite the number of cases falling, the virus is still circulating, and we know that this crisis is far from over. And we must remember that many who have tested positive for COVID-19 have not exhibited any symptoms at all. Since the pandemic began, this administration has continually worked to ramp up testing. Today, testing is available for all residents who want it or need it. There are 255 public and private testing sites, including in select Rite Aid, CVS, and Walmart locations. Visit covid19.nj.gov/testing to find a site near you or to talk to your doctor. If you are uninsured, multiple sites throughout the state will still provide a test, and a number of the testing is for free. Getting tested is essential in preventing the resurgence we are seeing in other states that have opened their economies. Our work is far from done. We have to encourage our friends, our families, and our colleagues to get a test. Testing is vital to slowing the transmission of COVID-19 because if we can identify positive cases quickly, we can track contacts and take the necessary public health actions to protect everyone. For my daily report, as the Governor shared, 1,512 individuals are in our hospitals, with 445 of those individuals in critical care and 72% of them on ventilators. I'm pleased to report no new cases of multisystem inflammatory syndrome in children. The ages of children affected, however, are from the age of 1 to 18. One child is still currently hospitalized. The breakdown of race and ethnicity is white 22%, black 34%, Hispanic 38%, Asian 6%, and other 3%. The Governor reviewed the new cases and deaths. In terms of deaths, the breakdown by race and ethnicity is as follows: white 53.8%, black 18.4%, Hispanic 20.4%, Asian 5.7%, other 1.7%. The state veterans' homes numbers have remained the same, as have our psychiatric hospitals. In New Jersey overall, on June 7th, the percent positivity is 3.8%. In the northern part of the state, it's 3.33%, central 4.06%, and southern 4.27%. Please continue to take precautions to limit the spread of COVID-19. Stay connected, stay safe, stay healthy, and get tested. Thank you.
Judy, thank you for that, and thank you for everything. The racial gaps continue to be overwhelming, and we have to repeat that. Also, if you've been out there protesting, we respect your right to do that. Who could blame you? The anger is overwhelming, justifiably, against the stain of racism that lives on in this country. But please be as responsible as you can for your health and the health of those around you. And I know you'd want me to say that. Wear a face covering. Try to keep social distancing. Wash your hands with soap and water. Get tested. I was out there, as some of you may know, on Sunday. Tammy and I and our son Josh all got tested. By the way, we all came back negative. That's my third test since this onset. But I just want folks to remember, Judy made this 200 and something locations. It's become, we're the #1 testing state in America. It's easy to find. Again, covid19.nj.gov/testing. Just go on there and you'll see the 250 something places. and get tested. And by the way, that's for your own good, but you're also doing the collective, the common good a favor, because the more data we have, the better we're able to deal with this huge challenge. So thank you for reminding us of that and for everything. Pat, there's a big day in your family today, so I want to give a shout out and a huge happy birthday to your mom, Carol Callahan, one of the great New Jersey moms. Witness the son that she brought up. Please, with that, please give her a big hug virtually, I assume, for us, and please give us, if you could, an update on compliance and other matters. Happy birthday, Mom.
Thanks so much, Governor, and good afternoon, everyone. Compliance remains extraordinary, Governor, and everyone. I think we had upwards of 20 protests yesterday, all ended peacefully. I think today there was 5 scheduled. I think the weather and the thunderstorms expected this afternoon may, hopefully we'll still keep them peaceful, but they may shift and be rescheduled. We continue to monitor that. And I just wanted to take a minute, Governor, I know it was announced earlier in the week, but to thank you, the Attorney General, and the College of New Jersey for what we're doing with the 160th State Police class. Unprecedented that we shifted gears and in short order came up with a plan to partner with President Catherine Foster and TCNJ to have nearly 200 recruits still remain in training. Just a phenomenal effort. I got to tour the campus last week. The AG and I will go speak to them next week, but I just, again, thank you for your support in that, because we certainly need those Jersey troopers, so thanks, Gov.
Amen to that, Pat. And I'm not asking how old your mom is, because I know how moms are like that, so just give her a hug from all of us. God bless you, Mrs. Callahan. We're going to start over here. Before we do, Dan, are we at 1 o'clock tomorrow? Is that correct? Okay, so unless you hear otherwise, we're at 1 o'clock tomorrow. We'll start right here with Elise in the front. Good afternoon, Elise.
Hi, good afternoon.
Ashman with the mic, by the way.
An increasing number of towns and local businesses are rejecting your executive orders and opening restaurants and retail and other services, and even conducting graduation ceremonies on their own. Has your administration warned these entities that they face enforcement? Do you plan to step up enforcement in Asbury Park for the planned restaurant reopening? Thank you.
Thank you, Elise. Yeah, the answer is yes to all of the above. And we've been in touch. You may know more communities that I'm aware of, but I know that we had exchanges at a minimum, obviously with Asbury Park, because I mentioned it. I know we had a good constructive conversation with Brick's leadership on an unrelated matter. I know Wayne was looking at doing a graduation ceremony next week. The good news is it appears to be organized in the way we want it. The bad news is we're not allowing them till July 6th. There was a theater, I think, near Atlantic City, Pat, that was opened, and summons were, and that theater is closed.
To my understanding, they did not open today.
So the answer is yes, we have to. There's one set of, and this is, by the way, we're not patting ourselves on the back. We're not trying to Bigfoot people. The facts are the facts. Inside, sedentary, no ventilation, close proximity is hard. Will we get there? God willing, yes, and I hope sooner than later, and I hope we'll be able to give guidance on dates sooner than later. I believe, Judy, I don't want to get out ahead of myself. For instance, we have nail salons, hair salons, and barbershops a week from Monday, and I think you and DCA are coming out with guidance as early as tomorrow. So we're trying to put a date out there when we feel we can comfortably do it, and then have enough of a runway with the guidance so that folks can get ready. And some of the stuff's complicated. Indoor dining would be high on that list. But the answer is yes, we will continue to enforce, particularly, as evenly as we can, and where we think there's public health is at risk. And again, we've been in touch with, we're in touch regularly with communities, obviously, but we're in touch with the communities I mentioned, and I'm sure many more on specifics. Thank you for that. Sir, back to you.
Hey, Governor.
Hey.
Regarding data determining your actions, what are the data points you want to see before telling restaurants they can fully reopen? What will you do to restaurants that decide to reopen despite what you said today? Fine them, arrest the people who open them up, close them down? Can we get specifics about what's being done regarding child care inspectors at DCF? And do you have concerns about opening centers when the child inflammatory syndrome cases are going up? We asked about this, I think, about a week ago, and you referred us to a website that doesn't have specifics. And Your administration
Last one, please.
continues to deny or not respond to Oprah requests about its response to the virus, like cleaning records for NJ Transit. Why hide this information from the public?
I love the premise of the question. Why hide this information? Thank you. We haven't mentioned this in a while, but we had a chart that Judy and I at least referred to. We may have had it in our daily slide deck. Slide deck dates me, I believe. I shouldn't have said that. It's more of the same data at this point. And the slide I'm referring to looked in a theoretical window. I remember having an exchange with Paul Mulshine about this. A theoretical window at any point in time, if you make a decision versus making it 2 weeks later, the impact on the rate of transmission is dramatic. So I'm not going to give you a specific data point, but time on the clock, not forever. This is not a life sentence here. We're talking now about a number of weeks. More improvement in the data has an outsized impact on driving the virus to the ground. What do we do to restaurants? Listen, first of all, restaurants have our enormous sympathy. Restaurants, bars, hospitality have been crushed. We are working, I promise you, hard morning, noon, and night to get to a responsible point to reopen, and also the parameters of what that will look like when we're able to reopen. And it's more right now as it was with Asbury Park. None of us, to the best of my knowledge, have exchanged with any restaurants. We've exchanged with the governing body in Asbury Park to make sure that the communities are giving the right guidance. I think that theater that we were talking about, the gym that we spoke about a few weeks ago, there were several days of summonses, and most people, again, the compliance is overwhelmingly in the right place, and it's overwhelmingly impressive, almost unlike any other state in America. I think we've addressed Oprah before. Matt, do you have anything you want to add? Matt Placken is with us. We've nothing new on that. By the way, Jared, I didn't give you a shout out. Director of the Office of Homeland Security and Preparedness. Forgive me for that. Judy, either child care centers vis-a-vis DCF coordination and/or your opening child care with this child inflammatory syndrome out there. Again, as you mentioned today, it's holding at 39. And we wish every one of those blessed little kids a quick, speedy, and full recovery. And we don't make light of any of that, but it is 39 out of 9 million of us, and I don't know out of how many kids. But anything you want to add to opening child care, which is coming on Monday, by the way, the 15th.
Yeah, I think, we have the guidance out and the protections are in place. We do know of the 39 children, every single one of them have tested positive for COVID-19, or they have tested positive for antibodies to COVID-19. So with the appropriate screening of children on their way in, and one of the questions being asked, have you been exposed to anyone in your household that's tested positive for COVID-19, would be a screening question that would exempt the individual from coming into child care. But I don't know, Ed, if you have anything you'd like to.
No, I think the commissioner said it well. This is a real risk, but luckily it's still a very small risk. And with the types of preventive measures that are in place, while we can never get the risk down to zero, do feel that compared to everything else that needs to happen, that you need to have these centers open so that people can go back to work, that we can reopen, that, again, unfortunately we can't make it completely riskless, but doing everything that we possibly can.
Yeah, I think it's important to note it's a syndrome. So it's not a communicable disease. Is that right, doctor?
Yes, meaning what happens is it's the body's response to the infection is rather than an infection itself, meaning as bad as this is, and we still are learning, so what I'm saying here is not 100%. Likely by the time the children are sick enough that they are having this syndrome, they are probably not significantly infectious anymore. Because again, what's happening is they got infected, they had the virus in the body, their body is responding to that virus, and it's that response to that virus that's causing most of the problem.
A couple of quick things before we move on. One is child care, outdoor dining, non-essential retail, whatever it is we get to indoor dining, nail salons, etc. I don't think any of us should expect that everything is going to spring right back to where it was on March 1st. And that includes daycare and child care. I mean, I think this is going to be That we showed that slide earlier. Confidence is a big factor here, and we want to give as much confidence as we can. Secondly, I want to repeat something that we've repeated several times. There has been, and blessed, it was a 4-year-old, bless that child's loss of life, but one loss of life under the age of 18 so far, and that remains the case. I've given you this 65 and up. 50 and up is 95.4% of lives lost. 95.4% of the lives, precious lives lost, have been the age of 50 or more. Daniel, welcome.
One of the questions that we've been getting from readers with the restrictions on loosened for outdoor and indoor gatherings and outdoor dining and religious services, does that mean that someone could have their wedding starting on next Monday and get catering and rent out the event space? Would a wedding count as a religious ceremony and be exempt from some of those standards? With the Bank of America issue, what exactly was this hiccup? Has it been resolved?
Is the Bank of America question unrelated to weddings?
Yes.
Okay, just checking. Thank you.
Has it been resolved?
Shifted gears there a little quickly.
Yeah.
So I'm sure I had that.
As everyone whose payments were delayed, have they received it? We're still getting complaints from readers that they haven't gotten it. If so, why haven't they got the payments and when will they get them? How close is the Labor Department to having to replenish its unemployment trust fund? I understand it's around $2.4 billion. That's in the entire pool for the state's labor trust fund. That's it.
Thank you, Daniel. I'll take, Rob, give me a second, then we'll come back to you. One of the things we've heard a lot, I've mentioned indoor dining and restaurants. We completely get it and understand it, and I promise you, as soon as we feel we can responsibly get to that, we'll get to it. Unless Matt corrects me, my guess is you should assume that will be twinned with catering halls, indoor catering halls, Judy, I would think, right? And I think one of the things we recognize, particularly in a big event like a wedding, you need a significant amount of advance notice for obvious reasons. And my hope is that we can give some guidance, even if the date is down the road, sooner than later. Sometime I would hope would give guidance in terms of dates in the next couple of weeks. And I think that's it in terms of the guidance. I think that was that what you were asking about? Come on, 1 second.
And so what about the outdoor weddings? Limit on indoor religious ceremonies? It doesn't seem to be.
The limit on indoor religious services is what it is. And outdoors, I think, are you asking could a wedding be a part of the gatherings we've got outdoors?
Yeah, with outdoor
Yes,
catering.
the answer is yes, as long as it stayed within under the limits at the moment of 100 people and properly social distance. Chris Ryan, our Chief Technology Officer, sends me a note, hot off the press, Bank of America issue is fully resolved on both sides. But Rob, why don't you add some more color to that?
Yeah, I don't want to overstep Chris. I mean, it's a statewide issue. But I think I heard the other day that some of the smaller banks on the other end might not have gotten everything into their account yet. But on our end, as far as we know, that everything has been processed through the Bank of America as far as our money's leaving us. On the trust fund side, thanks to this administration and the work of the legislature and prior legislatures, we're one of the strongest trust funds in the nation. We went into this pandemic in very strong shape. Our UI trust fund was the most solvent it's ever been. But based on projections, we're going to need to submit a request to the U.S. Department of Labor to borrow. We get that request in before July 1st, so we'll have it because it's a 3-month rolling loan and it's interest-free until the end of the year, thanks to the CARES Act. We'll definitely be talking to our delegation also about expanding the length of that interest-free period for the trust fund. Luckily, we've been in good shape for a long time. Many states have to start borrowing right away when they started hitting. But yeah, we're going to put a request in by the end of the next month to put a. I'm sorry, before July 1st, we have to get the request in.
I mentioned Chris. We're good. I mentioned Chris Ryan, our Chief Technology Officer, just had his second grandson, Finn Ryan.
Nice.
I'm not sure if he's Irish or not, but we'll check on that. Thank you. Sir, do you have something in the back?
First, I have one from News 12 New Jersey's Walt Kane. He says, Earlier, you said 94% of people who claimed unemployment benefits were being paid, but last week the Department of Labor told us that when you talked about people who were receiving benefits, you meant anyone whose claim status switched from pending to filled. So have all of these 94% actually received money, or are some of these marked not payable? And if all of the 94% are getting money, are they getting money every week? Or does this number include the people who got only one payment and then payments stopped? And then I have two from News 12 New Jersey.
Real quick, please.
Alex Adan. Governor, do you have any guidance on plans to reopen gyms, and if so, when? And will it be mandatory for businesses or employers to post the One New Jersey pledge signs in order to reopen?
I'll take the back two, and you could take the, we've got no guidance on gyms. Gyms are hard. And Judy and Ed know this better than I do. And believe me, we want to get there, but that's hard, but by very nature. We want folks to voluntarily commit to the precepts of the One Jersey Pledge. And by putting it in your window, that you're accepting your responsibility between you and your customers and between you and your employees. And by the way, vice versa, as I mentioned, customers back and employees back, so that when you go in there, you know you've got to wear a face covering, et cetera, as a customer or employee. Rob, do you want to hit what the definition
Yes,
is?
and thanks for the question, and I would love to have Walt sit down with our data folks for a few hours, because this is very complicated stuff. To be very clear, the 94% is the percentage of folks who have been deemed eligible. They have received payment of some kind. Those are the numbers we have to report to the U.S. Department of Labor. We don't have a lot of flexibility about what we can report and not report. But yes, he's right. That 94% includes folks who might have collected for a week or two and then went back to work, or their employer got the PPP loan. That is the percentage of folks who have received payment at some point in time who are eligible for benefits, yes.
Thank you. Thank you, Rob. Sir.
Governor, late last month, the Attorney General put a halt to no-contact curbside pickups of books from libraries. Many people, including...
Folks with what, sorry?
Excuse me. Late last month, the Attorney General put a halt to no-contact curbside pickups of books from libraries. Many people, including those with lower incomes, rely on libraries for books, music, and DVDs. Health experts are saying there's less risk in getting the virus from touching surfaces. If stores are open for no-contact curbside pickup, why can't libraries do the same?
Is that it? Yep. Matt, I'm going to ask you to weigh in on this. We want to get to libraries, I know, sooner than later, but as a non-contact curbside pickup matter.
Yeah, well, like the governor said, we're working on guidance for libraries, and we'll have to come back to you. We're hoping to have that resolved shortly.
There is, the premise of your question is a good one, and there's been a little bit of the World Health Organization on the one hand and the CDC on the other hand have revisited a couple of sort of gospel truths here, one of which is the surface question and how long the virus lives in a surface head. And the other one, which I think the WHO retracted almost as immediately as it went out there, was that an asymptomatic person was not likely an infector. I would say with the experience we have in New Jersey, and I'm practicing without a license, we beg to differ, particularly as we mentioned in long-term care facilities. But it's the premise is a good one. Ed, any comment on surfaces?
No, absolutely right. Many respiratory viruses, fomites, which are surface contamination, is a common way that these things can spread. You get it in your hands, you touch your face. That's why we continually tell you to wash your hands over and over again. And while, again, I've said this many times, I'll say it again, we continue to learn about this virus. There is some suggestion that it's not as easily transmitted through these surfaces, through these fomites, as might have originally been believed. But I would still absolutely encourage everybody out there to continue to wash their hands and be careful, because we still believe that the transmission is possible.
I mean, it's not part of the reason, it's a driving reason why we're still not there on playgrounds, on outdoor amusement centers, water parks, et cetera. I hope we get there sooner, but again, I mentioned Tony Fauci, Ed Lifshitz, Judy Persichelli, Tina Tan, you name it, Debbie Birx, the World Health Organization. This is a work in progress to understand all the dimensions of this virus and what it looks like, what the legs associated with it are, and what we need to be doing to prevent its spread. So good premise, and I appreciate your raising. President Brent Johnson is going to take us out.
Churches want to know if they can allow more than 50 people if they have enough space to distance. Will there be any enforcement if they do? When can a legitimate massage parlor expect to reopen? And if we don't know when, will that be, legitimate. Will that be part of stage 3? What will businesses what are they going to be required to do under the One Jersey Pledge? Are workers going to be allowed to stay home if they don't feel safe returning to work? And will there be protections if employees are not taking steps? Will you commit to signing legislation giving the public access to police disciplinary records in New Jersey if the legislature passes it? One more for you, and then should the corrections officer who mocked protesters be fired, and if not, why? Should he lose his pension? For Colonel Callahan, will Asbury Park restaurants be ticketed if they reopen Monday? And for the Labor Commissioner, are any gig workers getting more than $231 for their regular weekly benefit? Readers have told us they haven't spoken to any gig workers who are getting more, even if they had higher earnings.
Okay, I'm going to go real quick on a few of these and then turn it over to my colleagues. Listen, we're not going to, unless Pat tells me otherwise, we're not going to have police officers at the doors of temples, churches, or mosques over the weekend. This is going to be, we hope, overwhelmingly self-regulated and self-policed. And by the way, as Matt reminds me, this is not a forever. So we started at a very small number in outdoor gatherings. We've begun to grow it. If we get good results and our health data continues to be constructive, you should anticipate that we will grow the indoor capacity numbers as well. I don't have any guidance on legitimate massage parlors. I think we're going to try to, that's on a list of things to wrestle with. The One Jersey Pledge, I think what it makes sense, because it was really hard to read this, I assume, where can we find this, guys? Dan, can folks go on? We'll post it to the COVID website. We'd love you to look at it and get your reaction. And then tomorrow, if it doesn't answer the question, it's quite comprehensive and it's quite easy. And frankly, it's a two-way street. I would say this, as we've said, I think a few times since the killing of George Floyd in particular, the Attorney General is reviewing from soup to nuts the entire updating of the use of force protocols. We mentioned the licensing of police, and there are a whole lot of other pieces of the puzzle that are on the table right now, and that is one of them, access to there are a number of different pieces there. I don't want to marry myself one way or the other, but reimagining the relationship between law enforcement and the public and the community, where I believe we've made an enormous amount of progress in the past 2.5 years, and I want to, again, give Pat a huge shout-out for that. But it's quite clear, based on the past, if it wasn't clear already, the past couple of weeks, we have a ways still to go. Although I have to say this, we haven't said this today. I think you did, Pat, I haven't. The peaceful protesting has set a bar unlike any American state. So the fact that you're all still out there with anger and passion, rightfully so, against the stain of racism and the killing of this innocent man, but you're doing it peacefully, is incredibly laudatory. The corrections officer has been suspended, and I've got nothing beyond that. It was reprehensible, and we will, that's a process that has to take its course. I think we've answered Asbury Park, Pat, but you can weigh in. I mean, we're going to be, most importantly with Asbury Park, we've been engaging actively with the governing body. That's where the first wave has to be, and we completely understand the pressure to get open. Let's get open outdoors first, and then we can get to indoors. I'm not sure you got anything on that. You're good. And then, Rob, you take us home with the 231 question.
Yeah, real quick, I mean, just because you mentioned gig workers, and this ties into the UI Trust Fund as well. We were in a good spot with our trust fund because this administration has gone all in on fighting the misclassification of workers. And because that we have employers and employees both paying into our trust fund, we were in the good spot that we were in. That being said, there are still way too many companies out there who owe this department, and right now they owe 1.2 million workers in New Jersey millions of dollars for their unemployment trust fund. That being said, on the gig workers, for PUA, which is called the Pandemic Unemployment Assistance Program, I think I'll get a firm answer to your question if any have gotten more. I think there are some that have received their full amount if we had records from them with Treasury of some kind. So other ones, I think we're still waiting for e-adjudication. And just to be clear, it's not just 231. They're getting 231 plus 600. So they're getting 831. And throughout this pandemic, every decision we've made has been about getting the most people money as quickly as possible. So that's why we didn't want to wait for the adjudication, certification of what their other earnings are. We got that process up and running quickly as possible to get more people paid quickly. I think in the coming weeks they'll be contacted about, through the e-adjudication process, to submit more data and earnings for us to get them up to the right number if it's not 231.
You know, I mentioned last thing on faith gatherings this weekend, and while it is still true that we're not going to have law enforcement at the doors, it is a standard gatherings limit, and it's across the board, and we're doing it for public health. And so, folks, we do expect that it will be followed. And by the way, I again repeat that it's not a forever reality. I hope that over time we're able to address that as long as the public health data continues to be positive. I don't want to speak for you, Judy, but we could, as we've made progress in lifting capacities outside, we would fully expect that we can make progress on capacity indoors. So please, I don't want to be cavalier about it. It's for good reason. It's there for a reason. Please adhere to it. And we're happy that we're back to at least some semblance of a new normal as it relates to faith and worshiping. So with that, I'm going to mask up. Again, I want to thank Judy and Ed, as always, for everything. Rob, it's good to have you back, and thank you for the enormous progress. And for folks out there still waiting for Rob and his team to get to you, thank you for your patience, and they will get to you. You'll get every penny that's coming to you. Pat, again, thank you for everything, and happy birthday to Mom. Jared and Matt and Dan, thank you to each and every one of you. We'll be here at 1 o'clock tomorrow. And again, a couple of things to leave you with. Thank you, as we say every day, for everything you've done, whether it's compliance, staying home, playing by the book, exercising your common sense for the greater common good. No state's done it like us, and that includes the rightful right you have to protest and to do it peacefully, which is extraordinary. If you are out there and you're in close proximity, wear a face covering and please get tested. We have the capacity. We can take the numbers right now, and that wasn't always the case. No state can take the numbers at the extent that we can. And again, we're opening up in these stages for a reason. We completely understand the economic impact. Look at the loss of jobs. Look at the crushing impact on small businesses, especially those in hospitality. We want to get there. Believe me, we want to get there. We have to do this in steps. We're taking a bunch of big steps over the weekend. Faith beginning tomorrow, Monday, outdoor dining, non-essential retail, daycare. We got salons and barber shops and other steps coming on the 22nd, a week from Monday. As I said, I don't say this lightly. We know we need to give you guidance on some things that are not in the next week or so, but are going to come, we hope, down the road, and that you need a longer runway on some of that. We get it, and please watch that space. In the meantime, God bless and thank you.